Today we are going to talk about leg bones, tibia and fibula. This is tibia. It is a long bone which has upper end, lower end and shaft. So when we see the lower end, this projection is called medial malleolus. Correspondingly, in the upper end, this is medial condyle, lateral condyle, and this is tibial tuberosity. This is backside of tibia. So now what are the borders and surfaces of tibia? Tibia is a homologous bone of radius in upper limb. So the borders are anterior border, medial border, lateral border. Surfaces are anteromedial surface, anterolateral surface, posterior surface. This is superior surface of condyles, which shows the region for lodgement of meniscus, medial and lateral meniscus. Between two condyle is intercondylar area. This is intercondylar eminence. This is tibial tuberosity. So this is anteromedial surface. Upper part of anteromedial surface gets 3 muscle attachments. Here this is front of tibia. Medial condyle, lateral condyle, tibial tuberosity. From tibial tuberosity is anterior border, anteromedial and anterolateral surface. So upper part of anteromedial surface receives attachment of sartorius, gracilis and semitendinosus from 3 different compartments of thigh. Upper part of anterolateral surface or just below the lateral condyle, there is a tubercle called Gerdy's tubercle, which receives attachment of iliotibial tract. So entire anteromedial surface is subcutaneous, whereas anterolateral surface receives attachment of tibialis anterior. Now what are the muscles related to the front of leg? So in the anterior compartment, here is the attachment of extensor retinaculum. From medial to lateral, we have tibialis anterior, extensor hallucis longus, artery, anterior tibial artery, nerve, deep peroneal nerve, extensor digitorum longus, peroneus tertius. So these are the structures present in the anterior compartment of leg. Now here we can see the attachments in the posterior side. This oblique line in the posterior side is called soleal line. So this is posterior surface of tibia. The soleal line receives attachment of soleus muscle. Above the soleal line is the attachment for popliteus muscle. The posterior part of medial condyle gives attachment to semimembranosus muscle. Here posterior part of lateral condyle gives attachment to popliteus. Below the soleal line, a vertical ridge divides the posterior surface into medial and lateral part. Here so this is posterior surface of tibia. This oblique line is soleal line. Above this is popliteal surface. Below a vertical ridge divides the posterior surface into medial and lateral part. So this is lateral part and this is medial part on the posterior surface, and this lateral part gives attachment to tibialis posterior. The medial part gives attachment to flexor digitorum longus. This is articular surface for talus. This part of the bone articulates with a dorsal bone called talus to form ankle joint. Now this is tibial tuberosity, which gives attachment to ligamentum patellae. Ligamentum patellae is attached from apex of the patella to this tibial tuberosity. And this is upper part of anteromedial surface of tibia, which gives attachment to sartorius, gracilis and semitendinosus. This is Gerdy's tubercle for the attachment of iliotibial tract. To anteromedial surface, no muscle attachment. Anterolateral surface, tibialis anterior. Just adjacent to this on the posterior surface, that is, lateral part of posterior surface is tibialis posterior. So anterolateral surface is tibialis anterior. Lateral part of posterior surface is tibialis posterior. We can see both anterior and posterior adjacent to each other. And this medial part of posterior surface gives attachment to flexor digitorum longus. So here, what are the muscles in the anterior compartment of leg? We have attachments from medial to lateral. This anteromedial surface, no muscle attachment, whereas anterolateral surface gives attachment to tibialis anterior. So other than tibialis anterior, all other muscles takes attachment from fibula. So this is anterior compartment. In the posterior surface, we have attachment of tibialis posterior and flexor digitorum longus. So flexor hallucis longus takes attachment from fibula. Now coming to the upper part of tibia. So this surface is upper surface of the condyles of tibia. Here we have two cartilage called meniscus, medial meniscus and lateral meniscus. So when we see the tibia from upper side, we can see two condyles, and this condyle has moon-shaped structure called meniscus. On the medial condyle is medial meniscus. On the lateral condyle is lateral meniscus. And between two condyle is intercondylar area. So from anterior to posterior, the structures are medial meniscus. We have anterior cruciate ligament, then lateral meniscus. This is intercondylar eminence. We have lateral meniscus, medial meniscus and posterior cruciate ligament. So we should know the structures in order from anterior to posterior. We can remember it as small LMP. So what is small LMP from anterior to posterior? M stands for anterior horn of medial meniscus. So each meniscus has two horns, anterior and posterior horn. Next to anterior horn of medial meniscus is anterior cruciate ligament. Then we have anterior horn of lateral meniscus, that is MAL, mall. Then we have intercondylar eminence. Then we have posterior horn of lateral meniscus, posterior horn of medial meniscus, then posterior cruciate ligament. Anteriorly, the cruciate ligament is between two meniscus. Posteriorly, cruciate ligament is behind the two meniscus. Here we can see again from anterior to posterior, anterior horn of medial meniscus, anterior cruciate ligament, anterior horn of lateral meniscus, behind the intercondylar eminence, posterior horn of lateral meniscus, posterior horn of medial meniscus and posterior cruciate ligament. So these are the structures in the intercondylar area of tibia from anterior to posterior. Now we can move on to fibula. Fibula is the lateral bone of the leg. So it is a long bone. Again, it has upper and lower end and shaft. So this is upper end and this is the lower end. This lower end has an elongation called lateral malleolus. When we turn the lateral malleolus, we can see a triangular facet and behind there is a fossa. So these are the two features seen on the medial side of the lateral malleolus. This talar facet has to present anteromedially, whereas malleolar fossa is present posteromedially. And when we put our corresponding side thumb in the malleolar fossa and hold the bone in upright position, we can determine the side of the bone. So this is lower end of fibula, this is lateral malleolus. When we trace the lateral malleolus upwards, we can see a triangular facet. So from the apex of this triangle, when we trace upwards, this will be our anterior border. Just closer to this anterior border is the medial border. So between these two borders is the medial surface. This surface is the thinnest surface in this bone, which is just 1 millimeter width. So this is medial surface between anterior border and medial border. So just opposite to the anterior border is posterior border. Between anterior and posterior border is lateral surface. Just near the anterior border, this side is medial border. Now between this medial border and posterior border is posterior surface. This surface is divided by the medial crest into grooved area and flattened area. So this entire surface is posterior surface divided by medial crest. So between anterior and medial border is medial surface. This gives attachment to anterior compartment muscles of leg. We know tibialis anterior takes origin from tibia, so rest of the muscles, that is extensor digitorum longus, extensor hallucis longus and peroneus tertius. All the three muscle takes origin from medial surface of fibula. From above downwards, extensor digitorum longus, hallucis longus and tertius. This is lateral surface. So this gives attachment to two muscle, peroneus longus and peroneus brevis. Lateral surface is between anterior border and posterior border. So this corresponds to lateral compartment of the leg. There are only two muscles, longus and brevis. Peroneus longus and peroneus brevis. Now between this medial border and posterior border is posterior surface. It is divided by medial crest. The grooved area has tibialis posterior attachment. The flattened area has flexor hallucis longus attachment. So this is upper end, the upper end of the fibula, that is head of the fibula or stelloid process, gives attachment to biceps femoris. This is neck of the fibula. The nerve which winds around the neck of fibula is common peroneal nerve. So we have to remember about foot drop when there is fracture at the neck of fibula. So this common peroneal nerve at the neck of fibula divides into common deep peroneal nerve and superficial peroneal nerve. Deep supplies the muscles of anterior compartment of leg. Superficial supplies lateral compartment. So to get better clarification about borders and surfaces, let's take a model. So this is lower part of fibula. When we trace the lateral malleolus above, we can see a triangular part. So from the apex of the triangular part, when we trace upwards, this will be the anterior border. So this is anterior border of fibula. Just medial to the anterior border is medial border. Between anterior border and medial border is medial surface. So this is anterior border, this is medial border, and this narrow surface is called medial surface, which gives attachment to extensor digitorum longus, extensor hallucis longus, peroneus tertius. These are all anterior compartment muscles of leg, which is supplied by deep peroneal nerve. Now between this anterior border and posterior border is lateral surface. So what are the muscles in lateral compartment of leg? Peroneus longus and peroneus brevis. Between medial border and posterior border is posterior surface, which is divided by medial crest into grooved area and flattened area. So here we can see the posterior surface. So what is attached to the grooved part? It is tibialis posterior. To the flattened part is flexor hallucis longus. So the muscle which is left in the posterior compartment of leg is flexor digitorum longus, which we have seen already in the posterior surface of tibia. Now regarding fibula, we should know it violates the law of ossification. So what is law of ossification? The secondary center, which appears first, fuses with the shaft last. But this bone fibula violates the law of ossification. One more point to remember: fracture neck of fibula leads to injury of common peroneal nerve, which results in foot drop. Thank you.